I've got, okay. MedArchive preprint submissions, posts, and key metrics 2019 to 2021.
Great, thank you.
Okay, good
And
to
thanks
go.
for having me at the Congress. I look forward to sharing essentially our first 3 years as an existing preprint platform at medRxiv. And I'm representing a large team, mostly folks at the Cold Spring Harbor Labs, along with folks at the BMJ, including Theo Bloom, who's here in the audience, who we all collaborated together to launch this platform. And it is not advancing. There we go. Just to be really clear, this work was supported in part by funds from the Chan Zuckerberg Initiative through the Cold Spring Harbor Lab. Chan Zuckerberg Initiative is providing funding to support medRxiv, although I don't receive any compensation from the foundation. So we're here this whole session. This individual session is all about preprints, and obviously preprints have exploded in use and visibility over the past 5 years. There are a number of different preprint platforms in existence. I put a bunch of logos around the edge just for level setting purposes. A preprint is a research manuscript that has yet to be certified by peer review and accepted for publication by a journal, while a preprint server is an online platform dedicated to the distribution of preprints. And there's already been some discussion around the potential benefits and concerns of preprints. I think some of the expected and easy benefits to point out are the rapid early sharing of new information within the scientific community. Preprints demonstrate scientific productivity and establish the provenance of ideas. Also allows you to cite your work and grant submissions and whatnot. It prompts scientific feedback and enhances collaboration among scientists who are paying attention to preprint platforms and looking to see what's coming out. It makes results from less publishable studies more readily available. Many of us in this room are investigators, have experienced sometimes the slowness of peer review. I think that is even more challenging in certain disciplines, in the clinical sciences, medical education, health policy related research, quality improvement and systems research, medical education research, all qualitative research. All of these take a long time to go through the peer review process, but it doesn't mean that these findings wouldn't inform the next sequence or generation of studies. It also fosters more complete results reporting and promotes research transparency by leveraging preprint platforms. There's obviously concerns, including and probably especially harm to the public from wrong information, especially from studies of medical treatments magnified by media reporting. And there's also concerns about preprint platforms being manipulated by commercial interests. Some of you were here at the last Congress where Harlan Krumholtz, my close friend and colleague, gave a big talk, one of the feature plenaries on the future of publishing, in which he announced that we were going to launch medRxiv, because we together had done a lot of work in thinking about where sort of the next step was in data, in open science and transparency. I felt like a preprint platform in health science research was necessary. Thank goodness that Theo was here at the Congress and that John Inglis was here from Cold Spring Harbor Labs, because we would have been in way over our heads just doing this on our own. But that talk led to us talking in the back and probably a year and a half of preparation and discussion that now has led to medRxiv. And that discussion included great conversations with editors at many journals, but I especially want to thank those at the JAMA Network who invited me to one of their editorial board meetings to present medRxiv and discuss it with them. The organization of medRxiv is that it's a not-for-profit and it's publisher neutral. So even though there's affiliations from the BMJ and Cold Spring Harbor Labs to launch this, it's not publisher favored. It's operated by staff who are based at the lab, but it's managed in partnership and was launched in June of 2019. We have very clear platform policies that we think are in the best interest of the scientific community. All submission requirements follow ICMJE guidance, requiring author details, funding statements, ethical oversight of all research, including a clear statement, and trial registration for clinical trials. Importantly, the platform only accepts research articles and study protocols. It can be any type of research article, but it has to be a data article. So that includes systematic reviews and meta-analyses, that includes data publication papers, but for the most part, it's trials, it's observational studies, and whatnot. We don't allow case series or other case studies, and we don't allow narratives editorials, commentaries, and whatnot. All submissions are screened by staff and affiliates before posting, and we have very clear signals for caution on every page that you land on within the platform and on the download of the article if you were to download it. The objective of this presentation today at the Congress is really just to descriptively characterize the submissions, preprint posters posted, and user downloads for medRxiv since its launch. We use data directly from the website, internal data, and altmetric.com data from June 2019 when it was launched to the end of July of 2022. We assessed all these submissions, posts, abstract views, comments, and withdrawals. We calculated the posting rate as the percentage of submissions that were posted to the site after passing screening criteria, again, ensuring that it represents scientific research. And we identified all posted preprints with altmetric scores greater than 1,000. And then through routine automated searches of PubMed and Crossref that happen every night by the platform, we identified published journal articles corresponding to posted preprints. Here you can see the submissions to our to medRxiv over time. And we were really proud when we launched in June 2019. We had steady uptake. I think within a few months, by November or December of 2019, we were getting about 50 submissions a week. And we were really proud, we were growing. Little did we know what was about to happen. And of course, submissions went from 50 a week to 50 a day to 150 a day. And we're drinking by the proverbial fire hose. Thus far, there's more than 41,000 unique articles that have been submitted to the platform. 34,000 of those have been posted. So that's a posting rate of about 83%. So about 17% of the submissions that come to our platform do not get posted. They do not pass screening criteria. I don't have details on why each one is not posted. For the most part, kind of anecdotally, they're case reports and they're not, they're narrative. They're not actual scientific data articles. These posts have come from more than 185,000 unique authors from more than 155 countries. Importantly, about 20% of articles that are posted to the platform undergo at least one revision by the authors, where the authors submit a follow-up that's been revised. Only 56 preprints have thus far been withdrawn from the platform, which is 0.16%. Xiaoting, she was talking about retracted articles earlier on the first day of the Congress. And about 55 or 54% of all articles that are on the platform are COVID-19 related. That is actually going down far quicker than we had anticipated. Obviously, we were the home to a lot of COVID-related science early on in the pandemic. And I would think it's actually like about 30% over the past 6-8 months. Here's monthly usage, just to let you know this is on a logarithmic scale. And so there's thus far about 133 million total abstract views. It peaked at over 10 million views in a month, and we've had about 64 million total downloads. The median number of abstract views per preprint is about 1,600. So a little bit more than that. And the median number of downloads for each preprint is 450. So there's actually a substantial amount of usage. Obviously, there's a lot of papers that get posted that nobody looks at and nobody downloads, but for the vast, majority, there's actually a fair bit. On the top left, you can see a landing page for just for an article that's posted to the preprint platform. It includes the title, the authors, all that good stuff. But we've also developed a number of community engagement sort of facilitators, I guess you could say, those buttons that you can see right here. And those link directly out when you click on them to everything that we've been able to find in the scientific community about, that discusses a paper that's posted to the platform. This includes comments that are directly posted on the platform site. It includes community peer reviews. It includes blogs, media posts. It includes tweets. Thus far, there's been 8,754 total user comments. 7% of preprints have at least one. And there's been 1.1% of preprints have an altmetric score of greater than 1,000, but the median altmetric score is just 2. And then we also link directly out to any manuscript that's published by a journal after it's been posted as a preprint. And thus far, about 40% of preprints have been published in more than 2,600 peer-reviewed journals. The median interval from preprint posting to publication is 150 days. And you can see the sort of declining rate. 63% of preprints posted in 2019 have been published, declines to 48% in 2020 and 23% in 2021. So just to wrap up, medRxiv grew rapidly since its launch, particularly for COVID-related research. Our posting rate of 83% reinforces the importance of screening to enforce platform standards. Number of limitations, even though this is just a descriptive study, obviously we're not assessing the quality of the posted preprints. The community engagement metrics are not aggregated, they're just available at the individual preprint level. Automated searches may not have identified all preprints that have been published, and future research should examine user experience. So thank you to the Peer Review Congress for having us to come and talk about this, and I'm happy to take any questions.
Thank you, Joseph. You have a question over there?
Yes, hi, I'm Martha from the US CDC. Just want to thank you for medRxiv, and also I was tasked with capturing all of the COVID literature for CDC, as well as partnering with the WHO to do that. And just want to advocate again, if you have first or user feedback or anything like that. I know resources are so limited, and I was so impressed with how much improvements happened just over the COVID pandemic. But for information professionals who are trying to keep researchers and policymakers on top of the preprint literature, the key components of APIs and exports and excellent metadata and also search capabilities are so essential. You guys have one of the best ones for preprint servers, obviously, but just wanted to put that advocacy out there again. So thank you again.
Yeah, no, thank you. I appreciate that. And we are always happy to do more. When we launched the platform, we actually did not have any funding. BMJ was putting in funding by helping to support the editors who were involved. Cold Spring Harbor was kind of building on their bioRxiv infrastructure. We didn't actually secure funding until about a year in. So, but we're always looking to improve the platform.
Thank you.
Hello, Vicente Amado Olivo from Michigan State University. I work on author name disambiguation, and so I was just wondering how medRxiv found roughly 185,000 unique authors.
So that's the unique corresponding author, which is done by ORCID. So it may not be perfectly accurate, but that's how we organize it.
Thank you.
We have a question from online.
Thanks, Joe. Jody Schneider is asking if your stats include information about bots, crawlers, non-human activity, search engines, things of that sort. And
yeah,
I
so
have a
the
follow-up question. Yeah.
Okay, the usage data excludes that as best as we can, through just sort of automated services that are available, and that does not count those automated bots that are tweeting in terms of like the social media engagement.
Great. And then a follow-up question on the nature of any comments in terms of their ability to improve the work, for example.
That is a great example. I mean, I can only speak to that anecdotally. I'll occasionally pull up kind of high, visible papers, and I'll look at the comments back and forth. Some of them are very constructive. Some of them are people, pushing their own agenda. I think it's a lot like any other place on social media. Our comment section is moderated, so it's not that you can't post something that's, that's nonsense, but there's a lot happen that's on Twitter that connects back to the platform that is gibberish.
Great. And in 2 or 3 sessions we have, or 2 or 3 presentations, we have a comment analysis.
That's
Thanks,
right.
everyone.
Yeah.
Exactly. And then we'll take one over there.
Karim Khan from Vancouver in the Canadian Institutes of Health Research Funding Agency. We have patient engagement as a big priority. So I wanted to put my hand up if anyone wants to talk about patient engagement and the PCORI people I'd love to meet. So you mentioned that it's like this is one of the issues about patient and missed patient information, but you have patient partners in your planning and in your group.
We did not have patients partnering in our group. We've actually thought a lot about how to do that well. In some respects, it's just because the sort of rocket took off before we had actually finalized planning, but it is something that we want to think about. And one of the most important things that we are constantly trying to make sure is that the preprints that are posted aren't going to lead to direct patient harm. And so we're like, that's one of the screening criteria. And so we think about that as, as papers come in.
Hi, Miriam Sabin, The Lancet. I also oversee our preprint server on SSRN. So I really appreciate your presentation. It's very interesting. I have a question around screening. We screen out papers, we review papers on the same sort of criteria that you do as well. Sometimes we get papers that have may be a concern for public health or a serious concern for public health. But their ethics statement is fine, their funding statement is fine, all of this. So in those rare circumstances, we do look at the quality of the paper and we discuss a bit and we decide whether we should post that paper or not. You know, this has become an issue during COVID-19. But of course, you know, in the whole, interest and ethos of preprints, that's a difficult decision to make sometimes, whether to hold back a paper or to allow it to be posted. And I just wondered if you do the same thing or if you could comment on that at all.
Yeah.
Thank you.
Well, first of all, let me just commend the staff at Cold Spring Harbor that do a lot of the screening. They're amazing. And they then, of course, either they can bring a paper to us that is a potential flag for harm, or an affiliate, because every paper then has to be screened by an affiliate. It's just a member of the scientific community that goes through, looks at the queue and says, is this a research paper? Yes, and passes it through. Any one of those two can flag it up to our sort of leadership meeting where we discuss these kind of problematic papers. And we've kept what I would say is a pretty conservative bar. If any one of us thinks it may cause harm, we just say better after peer review, right? And that's just kind of how it goes. And some authors are not happy about that, but we say, if you're right and your work is good, it'll move through peer review quickly. And we just don't want, we're kind of risk averse, I guess.
Back there.
Yeah, I think my question is probably very similar. You mentioned that only 56 papers were subsequently withdrawn. I was wondering if those numbers are only from author-initiated withdrawal, or if you have other numbers for papers that prove problematic after posting and then you remove them.
No, those are the ones that either that someone has flagged or identified and the author has withdrawn them. Thank you.
Over here.
Great initiative. I was wondering if you've thought about using medRxiv as post-print server as well, because I know a lot of people who, if they're university repository, they don't know how to use it, and it would make people change institutions a lot. So if they want to put something green open access, so if they published in a non-open access journal, but they want to store a version of their article open access, would people be allowed to put a published article on it's not necessarily a preprint, but I'm just wondering if you've thought about this or how
So
that would impact
our criteria is explicit that if the article is published by a journal, we won't post it.
Yeah.
That's our rule.
Gotcha. Thanks.
Go ahead. There. Go ahead.
Yes, Veronique Kiermer Plus. Thanks very much, Joe, for the presentation and everything you do. I was wondering if you have any data on the percent of preprints that end up being published and the delay between preprint posting and publication, and whether it's different between medRxiv and bioRxiv.
So I don't know if it's different between medRxiv and bioRxiv. And I went through that data quickly at the end, but in about 40, now I'm trying to remember the exact number, % of papers that have been posted as a preprint have been published thus far.
Yeah.
It's the papers that were posted in 2019, it's more than 2/3. The papers that were posted in 2020, it's about half. And the papers that were posted in 2021, it's like 25%. So clearly it takes time to get stuff published, and those rates will continue to go up.
Thank you.
Yeah, Stuart Taylor from the Royal Society. In fact, it was very similar to that question. Your 38.8% of preprints going into journals struck me as very, very low. And I was going to ask about the time course effect, which I think you kind of answered, but I think it's also potentially to do with the extremely rapid rise you had in a very short time, right? Because I would expect most preprints would end up in journals. Would you not?
I would say probably, I would expect about 80% to end up in journals, just by author experience, like knowing that some people abandon papers after they've been rejected a few times, or and if it's already on a preprint platform, they may feel like it's out there. Like I've done it, I've tried.
Right. Okay. So that's why the 38% seemed very low to me. Thank you.
Back there.
Hi, Damien Pattinson from eLife. I was curious about the growth. I mean, it appears that in the past year, it's been fairly steady state. And it's obviously still a very small fraction of the total published literature. So if you kind of take out the COVID bounce, are you still, seeing kind of growth month on month, and if not, what do you think?
Yeah, no, the non-COVID papers are continuing to sort of gradually incline, whereas the COVID obviously was huge and has steadily kind of gone down. So I hope that means that we're going to continue to do well. Initially we were comparing our trajectory to bioRxiv, the platform managed by Cold Spring Harbor Lab for the basic sciences. And they were very slow in the beginning and then steady. And then it just kind of culturally became the accepted norm. We're not there yet, but we'll see where we get to.
Okay, one last question very quickly, please.
Gunter Eisenbach, JMA Publications. So 2 days ago, I was talking about JMAX, an overlay journal on medRxiv. So we had to send a survey to authors to figure out whether they had already submitted this paper to a journal or if the preprint was actually submitted by the journal, which is another use case. Have you thought about improving the metadata and perhaps asking the author in the submission process things like, is this currently under review, or do you welcome unsolicited peer reviews, things like that? So from my perspective, there's a need to improve the metadata in that regard.
Yeah, no, it's a great question. And we've tried to balance the sort of how much to ask of authors and the burden in the submission process and sort of the risk reward. There's been many groups that have come to us and said, it would be great if you could just add this one feature. And if you added all those features, then it would take authors another 30 minutes to submit the preprint. But basically, we've tried to arrive at what we think is like the best balance, right? Because we do believe the metadata that are required around visibility of the authors, making sure that their affiliations or conflict of interest are disclosed, that we've prioritized. And we'll continue to entertain kind of like other things to add on top. But at this point, we haven't made any changes.
Thank you. And
can I ask a quick question? Is that possible? Just one quick small question.
We're totally out of time. Sorry.
Okay. All right. I'll ask you afterwards, Joe.
Yeah,
of course, no problem.
So thank you, Joseph. And